In this lecture, we will discuss about the pharmacological principles of chemotherapy in cancer, including its mechanisms, drug classes, and clinical applications. It is a very vast topic, so we will cover it in two or three parts. So let's start with the part 1, that is chemotherapy of cancer. If we look into the table of content, we will discuss firstly introduction to the cancer, classification of anti-cancer drugs, cell cycle, alkylating agents, that is classification, platinum coordination complexes, antimetabolites, microtubule damaging agents, topoisomerase second inhibitors, topoisomerase 1 inhibitors, antibiotics. Then we will discuss about targeted therapies in cancer, marine derived anti-cancer agents, advancement in chemotherapy, challenge in chemotherapy, and at last we will discuss about what are the future perspectives in the chemotherapy of the cancer. Let's start with the introduction. I have made this very short and precise and easy to understandable. So, if we will say what is cancer? Cancer is a group of disease which are characterized by abnormal and uncontrolled growth of cell. That is the important point. That is uncontrolled growth of cells with potential to invade to the other parts of the body. That process is known as metastasis. That is, cancer will spread throughout the body. So if we look into the what are the causes of cancer, there are three main causes of the cancer. First one is the genetic factor like mutation in the DNA. Second one is the environmental and lifestyle factors which include smoking, that is leading one, diet, UV exposures and radiation. And third is the carcinogens, that is these are the chemicals or anything or substances which can cause cancer to the human or any other body. So these are the three main causes of the cancer. Then we look into the types of cancer. There are five main types of cancer. First one is the carcinoma, that is cancer of the epithelial cells, skin or tissue lining of organs. Then comes the sarcoma, that is cancer of mesenchymal cells, bones, cartilage, and muscles. Third one is the leukemia, that is cancer of blood forming tissues. Lymphoma, it involves lymphatic system. Melanoma, that is melanocytes in the skin. So if we look into the what are the main symptoms of cancer if someone is having cancer, so these symptoms will impair. First is the abnormal weight loss, fatigueness, swelling or lumps in the parts of the body, unusual bleeding or chronic pain. So these are the main five symptoms of cancer. Then we look into the sorry then we look into the stages of the cancer. There are four stages of the cancer. Stage 0, it is when the abnormal growth of the cells begins. First, abnormal cells grow in the body but they do not spread, they lie on the same place where they start the growth. Stage 1, it is localized cancer. Stage 2nd and 3rd include the regional spread, and stage 4th is the metastatic cancer, that is the cancer has spread to the all parts of the body. So, what are the treatment options? If someone is having cancer, what are the treatment options for that person or that patient? First one is the surgery, but surgery is not possible in all parts. For example, we say if the tumor or cancer is deep inside the brain, their surgery is not possible. So, we have to look for the other options. Then comes the chemotherapy, radiation therapy, immunotherapy, targeted therapy, and gene therapy. It is the new one and it is the most important one. Okay, let's start with the basic concept of chemotherapy. Chemotherapy refers to the use of chemical agents or drugs to destroy or inhibit the growth of cancer cells. Okay, so these drugs mainly act by interfering with the cell division and vital cellular functions. Here we see a word that is called selective toxicity killing. So, what is this? This means that the drugs are designed to target cancer cells more than the normal cells. So when we take a drug, it targets the cancer cell as well as the normal body cells. But in selective killing, it acts more on the cancer cell than the normal body cells, while causing minimal damage to the normal body cells. although some normal cells can also be affected. So if we look into the another mechanism, that is how chemotherapy works. It targets rapidly dividing cells, disrupts the cell cycle, that is it mainly acts on the G1, S, G2 and M phase, and it induces apoptosis in the cancer cell, that is the programmed cell death of the cancer cells. So, in simple terms, we can say that chemotherapy works by three main mechanisms. First one is stopping cell division, second one is damaging cancer cell DNA, and third one is ultimate killing of the cancer cells. That is the three main mechanisms how chemotherapy works. Here comes the most important and high yield classification slide. So, here we will classify the anti cancer drugs into two main categories. First one is the cytotoxic drugs and another one is the targeted drugs. In cytotoxic drugs, we are having further classification, that is alkylating agents, platinum coordination complexes, antimetabolites, microtubule damaging agents, topoisomerase second inhibitors, topoisomerase first inhibitors, and antibiotics. If we look into the targeted drugs, we are having hormones and anti-hormones, tyrosine kinase inhibitors, angiogenesis inhibitors, immunotherapies, and proteasome inhibitors. If we look for alkylating agents, these are the agents that damage the DNA. Platinum coordination complexes, they like cisplatin, they also cause DNA cross-linking, and they will inhibit the cross-linking of DNA and inhibit the cell growth. Microtubule damaging agents, these inhibit mitosis and cell division. Topoisomerase second inhibitor, they prevent DNA unwinding. Topoisomerase first inhibitor, they interfere with the DNA replication, and anti-tumor antibiotics, they cause DNA damage. And if we look into the hormones and anti-hormones, they are used in dependent cancers. Tyrosine kinase inhibitors block signaling pathways. Angiogenesis inhibitors stop blood supply to the tumors. Immunotherapy boosts the immune system to fight against the cancer, and proteasome inhibitors disrupt protein degradation in the cancer cells. This was the basic classification of anti-cancer drugs. In part 2, we will dive deeper into each class with their mechanism and example. So stay tuned with Medicine is Life for part 2. Thanks.